Keratoplasty, presented and narrated by Skylar Thomas. Keratoplasty is the clinical term for corneal transplant. The procedure is performed by ophthalmologists, and about 40,000 surgeries are performed each year. The cornea is the outermost layer of the eye that covers the colored iris and the round pupil. It is no larger than a dime and no thicker than a credit card. It is strong, durable, and transparent to refract light. The cornea is composed of 5 different layers. These layers are composed of cells and proteins. The 5 layers are the epithelium, Bowman's layer or membrane, stroma, Descemet's membrane, and the endothelium. The endothelium is composed of cells whose job is to keep the cornea clear. The cornea functions to shield the eye from harmful agents such as germs and dust. The cornea also controls and focuses the entry of light. In order to do this effectively, the cornea must be clear and cloud-free. A healthy cornea is crystal clear, allowing it to properly perform and provide 20/20 vision. 65 to 75% of the eye's focusing power begins with the cornea. If the cornea becomes injured, diseased, or scarred, it can result in a distortion of light that enters the eye and the glare is produced. If the cornea is not clear or without proper curvature, light can no longer pass through it. This can result in blurred, cloudy vision and even blindness. Individuals with trauma and injuries to the cornea are candidates for corneal transplants if a person's vision cannot be corrected using non-surgical means. This includes if a cornea is deeply scarred, vision cannot be corrected with glasses or special contact lenses, if painful swelling cannot be relieved by medications, and poor vision impedes performance and daily activities. Pre-op begins by the patient finding a donor. If a donor is unavailable, synthetic corneas are also an option, such as alpha-core synthetic corneas. A donor cornea must be harvested up to 24 hours post-mortem. Donor cornea is tested for AIDS, hepatitis, and other intrinsic diseases such as tumors and active inflammation. The patient goes through a routine checkup which involves a blood count and an EKG. Antibiotic drops are given at this time to prevent infection. There are several surgical techniques utilized based on the patient's diagnoses. The first technique is the penetrating keratoplasty, or PKP, which involves removing the entire cornea. A trephine is a small cookie cutter-like tool used to cut the diseased cornea. Once a diseased cornea is removed, the donor cornea is sutured or stitched into place. Here is a closer look at how a trephine is used. Here is a more in-depth look at PKP. In step 1, a surgical ring is sutured in place to keep the patient's eye open. Step 2, a trephine is used to make the initial incision. Step 3, the final incision is made with a surgical knife. 4, the cornea is removed, and step 5, the donor cornea is placed and sutured in. Here are 2 examples of how sutures are placed. The first photo shows interrupted sutures or individual stitching. The second photo displays a continuous stitch. Another corneal transplant technique is the Descemet's membrane endothelial keratoplasty, or DMEK. In some cases, only part of the cornea needs to be replaced. Instead of removing the entire cornea, ophthalmologists remove the diseased endothelial cells and replace them with healthy endothelial cells to help clear the cornea. The final technique is the deep anterior lamellar keratoplasty, or DULK. This procedure is utilized when a corneal disease affects only the anterior layers of the eye. This technique involves the removal of the anterior layers of the cornea and leaving the endothelial cells and Descemet's membrane in place. The donor cornea is set and sutured into place. Here is a before and after view of a cornea transplant. After the surgery, a patient's vision might be worse than before while their eye gets used to the new cornea. This is normal. The patient should not experience significant pain post-operatively, though some swelling and discomfort can be expected. Doctors recommend that patients wear a protective shield, and the healing process can take from several weeks to several months. Corneal transplants are safe and have a high success rate of 75%. Cornea transplant is a relatively safe procedure. Still, a transplant does carry a small risk of serious complications. Here are some of the risks. As technology advances, new technologies are now being introduced. This includes high-speed lasers that are used in place of blades, stem cells, which are used to create corneas, and biosynthetic corneas. For more information regarding keratoplasty, speak to your ophthalmologist or visit getismart.org.